is recorded.
Okay.
Yeah, because there's so many people that are not there. That
Meeting is now streaming YouTube.
All right. I think so. Yeah, we are. Okay, perfect. Good. Thank you. So welcome everybody. And tonight is a workshop, not our usual meeting, but a workshop on the kidney, the functions of the kidney, how our kidney functions and all of that. And so one of us, Adeline Achu, is going to be leading us. She is a registered nurse and works in the kidney unit. So well knowledgeable tonight. I want to challenge us to take notes. Maybe you know someone that has a kidney disease or something, or you don't even know, but you're going to learn something about your own self and how to cater for your own self. So it is very important that you be attentive and just find a notebook by you, because you might want to take down some notes. But the good thing is that we're recording this meeting, and it's absolutely recorded so that some people that are not here, a couple of people have said to record it so they would watch it later. And so you are going to hear from an expert. I am going to hand it over to her. Mind you, disclaimer, this meeting might go above our regular 1 hour, or if we see that it's going to, maybe she's not gone halfway, we would have to stop and then do a part 2 of it, because she has a lot of material. I have seen it. And if you have questions, please, I would say just put it in the chat that I have a question. So if we see that a lot of people have questions, we will pause and take questions first before we continue. She has quite a couple of chats. So without a waste of time, I'm going to hand it over to the Lolo, the Queen of Ottawa. Adeline, please take it away. Thank you so much.
Thank you, my head girl. Thank you, Canada Virtuous Women. Thank you for all the visitors and people, everybody that has connected on this platform to listen. It's such a privilege to share knowledge, to share what I know, so that in one way or the other, as she has said, it might help you, a family member, a friend, or somebody around you that has kidney issues or might be having it and they are not aware of it. So it's a privilege to share this on this platform. I do not take it for granted. I thank everybody here present, and I pray that at the end of this session, we will not go back the same. We will go back with something that will carry on and practice that will help our kidneys. So we're already behind, and as Sister Adeline said, we have a lot to cover. I will not waste time with that. I will just start by sharing my screen. Can everybody see my screen?
Yes, we can.
Hello?
Yes, we can.
Yes,
Yes,
we can
we
see
do.
your screen.
Yeah, we
Okay.
do.
So the first screen here is just the kidney. So we'll be talking about the kidney, and just the second slide is what is a kidney. Some people might not really know what's a kidney and where it's located in our body. The kidney is, there are two bean-shaped organs that are located in the back of our abdominal cavity, in the back. Some people think it's around the stomach, below but it's located in the back of the abdominal cavity. And the kidney has small units called nephrons that helps in the functional units of the kidney, helps the kidney to carry out all the different functions that it has. And we have about 1 million of these nephrons in each kidney. So every human being has 2 kidneys. Some abnormalities, some people are born with 1 kidney, which you can live the rest of your life with it without an issue. But under normal circumstances, everybody has 2 kidneys, and we have about 1 million of nephrons inside each kidney that helps to carry out the different functions of the kidney. And the kidney has 4 main functions, which we are going to elaborate during this session on, which are filtration, reabsorption, secretion, and excretion. So the main things that we're going to learn during this broadcast is to understand the functions of our kidney. As I just mentioned, 4 main functions. We are also going to understand the different diseases of the kidney, which we're going to touch on the acute kidney injury, chronic kidney injury, and end-stage renal disease. We will also talk about understanding the different causes of an acute kidney injury and how we can manage it. With time, if the time permit, we will elaborate on how you can stage a kidney disease when you are already at the chronic stage. How can we stage it to see the different levels and function that your kidney is, the percentage that your kidney is functioning at? Because at times when we go to the hospital, they say your kidney is 90% function, 30% function, you might not understand. So I'll give a brief understanding of this. So we move into the different functions of a kidney. When we talk about the kidney, how to care for the kidney and everything about the kidney, it's first of all very important to know what is the use of this kidney in me. We have different organs like the heart and the stomach and all of this. Today we're talking about the kidney. We need to know what's the use of the kidney. What is the kidney doing with me? Because if you don't know the use of a kidney, you might not necessarily put an emphasis on taking care of it. Because once you know the use, you know that if the kidney is not available, all these things will not happen in my system, in my body. So for that reason, I have to really take it serious to take care of my kidney. The first function of the kidney is filtration. 20% of the total volume of blood, total volume of fluid in our body, 20% of it pass through the kidney every minute to be filtered. So you can imagine that you have a total volume of fluid in your system of 100 or 1 liter, and 20 mils of it is passing through the kidney every minute to be filtered. So the kidney does a very, very important job to filter the blood, and we will elaborate on filtration. Reabsorption. The kidney reabsorbs whatever the body needs. That is because the kidney produces urine, and that urine contains excess of anything that the body has, or the byproducts or waste that the body does not need. But in as much as the body is sending out this excess, the kidney is sensitive to know that the body is short of water. For that reason, I will send back water into the system instead of putting it in urine and sending it out. So the kidney is very sensitive to the level of glucose, ammonia, sodium, all these little elements within our body, such that when any of them is short, when the kidney produces the urine, it senses that the shortage of water, this person is dehydrated. For that reason, it's gonna send back the water that was in the urine into the system to compensate. Just as if there's shortage of sodium, shortage of potassium, or any of these minerals or glucose in the system, the kidney sends it back into the blood such that it is not eliminated out of the blood, just to create that balance. The kidney also functions in excretion. All the different functions of the different organs in our body, digestion, you do exercise, you break down your muscles, all of these produce end products, useful ones that the body needs, and the waste from it that the body does not need. It is the kidney that excretes. It takes away all this waste, whatever the body doesn't need. And also the excesses. Maybe the body needs a glucose, but we have too much of the glucose. So the kidney is going to take the extra and send it out and leave just what is needed. In the course of doing this excretion, the kidney tries now to create a balance. The kidney tries to create a balance, hemostasis, a balance in the ratio of any element, any product that the body needs, such that there's no excesses and there's no less. So the kidney does a very good job with that. Again, the kidney maintains acid-base balance in the body. There are some organs in the body that functions well in acidic conditions, while others functions well in basic conditions. It is the kidney that senses that, oh, the stomach is too acidic, the stomach is too basic. I'm going to put in these minerals instead of sending them out, such that to make equilibrium for the stomach to function well. So the kidney does all of that in the process of excretion. The fourth function of the kidney is secretion. The kidney secretes 3 very important hormones in the body. First of it is erythropoietin. This erythropoietin is a hormone produced only by the kidney, which helps to produce red blood cells. It is in the marrow. It helps in the production of red blood cells so that the red blood cells mature. And you know, red blood cells are found in our blood. When you have less red blood cells, then you have anemia. You have less blood in you. So if erythropoietin is not produced because the kidney doesn't function well, then you tend to be anemic. There's also renin. It is also a hormone that is produced only in the kidney. And this renin helps to regulate our blood pressure. We have calcitrol. We consume vitamin D. Some of us, we take vitamin D supplements, we take calcium supplements. If the kidney does not produce calcitrol, which is a hormone, even though you take your calcium, the body cannot absorb it. The body cannot make use of that calcium that you have taken. It is the help of this hormone calcitrol that helps your body now to absorb that calcium that you swallow, maybe through a pill, or you ate it in food, in different food substances that you eat that contain calcium. You swallow your vitamin D, your body cannot absorb vitamin D in the form of vitamin D. It needs the hormone calcitrol to convert it to vitamin D3, which is absorbable, which is in a state where your body can consume it. So you realize that without the kidney functioning, these three hormones will not be produced, and then there's an issue. So what results when the kidney cannot do all of these four main functions that I'm telling you? There are other functions, but these four that I explained, they are the main functions of the kidney. When that doesn't happen, it leads us to kidney disease. And we have three main kidney diseases: acute kidney injury, chronic kidney injury, and end-stage renal disease. We start with the acute kidney injury. Acute kidney injury is a sudden dysfunction of the kidney. It happens suddenly, and this can be as a result of an infection. Somebody goes septic, like you have a blood infection. It affects your kidney, and suddenly the kidney shut down, or they slow down. They don't work, they don't function 100% the way they were functioning, or if they were at 80%, it goes down. You can have injury, you can have an accident, and you bleed a lot. Your kidneys are so sensitive to less blood flowing. Remember from the beginning, I said 20% of your blood volume passes through the kidney to be filtered every minute. So when there's less blood in your system, your body automatically tries to compensate. So blood now goes to the heart, it goes to the brain to furnish it with oxygen and other things. And the kidney gets just a little bit. When the kidney is getting only a little bit of that blood, then its function is affected. And then you have acute kidney injury. You can also have toxins. You can take medications that can affect your kidney, which I'm gonna elaborate further. And then acute kidney injury occurs to 50% of people that are hospitalized. Why? Because people that are hospitalized are already sick. When they're in the hospital, whatever illness that they have might lead to less blood flow to the kidney, less oxygen to the kidney, depending on what illness. And again, people that are hospitalized are on treatment, antibiotics, and so many medications. Remember, every drug that we take has its own side effect. And there are some of those drugs that they give us to treat some of the diseases that we are admitted in the hospital for, and it has side effect of affecting your kidney. That's why 5% of some people that are hospitalized end up with acute kidney injury. And the good news is this acute kidney injury is reversible if proper treatment is taken. If you notice the cause, maybe I had an accident, or it's too much bleeding. Maybe it is a medication that they gave me. Maybe it's an infection in my blood and they put me on antibiotics. Once they treat that cause, your kidney recovers. That's the good news with acute kidney injury. You can recover 100%, depending on your recovery, depend on other factors likewise. But what can cause other things that can cause acute kidney injury? The cause of an acute kidney injury can be something out of the kidney. Not necessarily that the kidney is not working well. Something might affect it not to work well outside the kidney. You might have diarrhea, vomiting. You might have a skin burn. or like I said, bleeding as a result of accident or anything. These are things that have happened to other parts of your body, but it affects the kidney indirectly. Why? Because vomiting, diarrhea, causes you to lose fluid. You lose a lot of fluid when you vomit, when you have diarrhea, when you have a burn, fire burn, like when you burn, your body is burned, you lose fluid, body fluid. And this leads to your blood pressure being low. Once your blood pressure is low, your body tries to compensate by sending less blood to the kidney. It doesn't get that 20% that it's supposed to be getting every 20 minutes. For that reason, the kidney suffers. And then it might result to acute kidney injury. It can also be as a result of something that is wrong within the kidney itself. The tubes, like I said, the unit for functioning for the kidney is the nephron, and we have millions of them in one kidney. Those nephrons can become inflamed. They don't have their normal structures for one reason or the other. It can be as a result of a nephrotoxic agent, like a medication. It can be chemotherapy. It can be antibiotics that has affected the structure of that kidney. And for that reason, the kidney cannot function the way it's supposed to function again because its structure has been tempered. Acute kidney injury can also come as a result of something out of the kidney. The kidney functions well, produces urine. Urine goes through to the bladder, but it cannot go out because the urethra maybe is septic. The urethra has problems, or you have kidney stones, or you have a tumor, or for men that have prostate is inflamed, or you have prostate cancer, they obstruct the flow of the urine from the bladder out. There's backflow, and all of that indirectly affect now the function of the kidney, and then you end up with acute kidney injury. As I said, good news is acute kidney injury is reversible. Once we notice what has caused it, like all these things that I've elaborated, they handle it, it goes back, and your kidney functions well. At times, the tubes, the tubules of the kidney can also go dead. Those small cells that are inside the kidney that helps to filter, helps to secrete those hormones that I talk about, helps to sense the excess and less of chemicals in your body. When they die, then the kidney cannot function well again because it will not be able to sense excesses and less. So for that reason, the kidney cannot function well, and in that case, you can develop acute kidney injury. And usually what they use to notice that you have acute kidney injury is some people will not produce urine for a couple of days, or you know that you always pee a certain quantity, and before you know, you're not peeing. 1-2 days, you're not peeing. It becomes a concern. Then we can look into it to check the glomerular filtration rate, which is the amount, how fast your kidney filters the blood that goes into it. And they can also check your creatinine level. Creatinine is a byproduct. It's a waste product of the breakdown of protein in and muscles in your body. So once that is broken down, this creatinine is not needed in the body. The kidney is supposed to eliminate it all. So once you have kidney problem, the level of this creatinine in your blood or in your urine slowly creeps up. I'm explaining this because at times you go and they check it and say your creatinine level is higher, glomerular. So you might not understand what it means. If your creatinine level is high, it means that your kidney is not eliminating this particular waste well. And that's one of the factors that they use to see the functioning of your kidney, to test and see whether your kidneys are working well. How can we prevent having this acute kidney injury? You avoid low blood pressure in the sense that you drink enough water. I have said it on this platform several times. Drinking water, enough water, 2 to 3 liters of water a day helps your kidney. Even the kidneys that already have problems, once you keep drinking that water, you're helping it. You're helping to maintain the kidney to function at the level where it is. Maybe it's functioning 50%. Drinking water can maintain it there or improve it, but it will help such that it will not decrease to 30% to 40%. And drinking water, if we say 2 to 3 liters, it is not just water. If you drink 1 liter of pure water and 1 liter of coffee, you join it, that it will make your 3 liters for the day. It can be coffee, it can be tea, it can be juice. But that fluid, try that every day you get 2 to 3 liters of water. And then some things that also cause acute kidney injury, they are called nephrotoxins. They are some products that are very toxic to the kidney. Once the kidney sends them, it's already affecting it. We have some antibiotics, some antifungi, and even some pain medications that are toxic to the kidney. We take them without knowing. But again, I'm not saying that don't take antibiotics. It is important to take the antibiotics when you have an infection, because if you don't, your whole blood becomes septic, the kidney will also still be affected. But mind you, antibiotics need to be prescribed, because when the doctors are prescribing it, they take into consideration your kidney function, your liver function, your height, your weight, and many other diseases that you might have. And for that reason, they will give you the appropriate dose to be taken and for the appropriate period of time. I understand when we're growing up in Cameroon, when somebody is sick, you go and you buy over-the-counter antibiotics. We do that out of ignorance. It is not safe at all for your kidneys. It is good to get that prescription, because somebody who is well-trained will give you what is right. When you take a good antibiotics, wrong dose, wrong period of time, it affects your kidney. It becomes toxic to your kidney. Same with antifungal medications. And some pain medications like Advil, ibuprofen, and ibuprofen. They are toxic to the kidney. And they are only toxic when you don't take them appropriately, or you take them too much for too long a time. It affects your kidney. Some people always say, oh, Tylenol affects the kidney. Advil affects it more. And Tylenol, you get a maximum of 4,000 milligrams a day. When you exceed that, then it starts affecting your kidney. So antibiotics are good, painkillers are good, but it is good to take the right dose. And for antibiotics, take what is prescribed, not over the counter, because you can have an acute kidney injury just from taking an antibiotics. Keep yourself hydrated is also very important, because at times when you're taking the antibiotics, even when it's the right dose and you're dehydrated, it affects your kidney. So you have to drink enough. Water is the best fluid to support the kidney function. It is the best, because there's so much that the kidney is supposed to eliminate. And if the kidney is having issues to eliminate that, and the fluid, your blood is so thick, the fluid that is coming to the kidney is so thick because you are dehydrated, you're not drinking enough, you're giving that kidney so much work. But when you drink enough, you're flushing it. You're flushing even the blood vessels that supply blood in and out of that kidney, and it helps it to function well. Water as well as cranberry. Cranberry juice is very good to flush the kidney. Cranberry juice and grape juice. If you can be taking that, if you don't like cranberry juice and take grape juice, that's fine. If you don't like any of the juice and you drink water, it is still very good. Now we have talked of acute kidney injury and what can cause it. How can you know that you have acute kidney injury? The signs and symptoms of acute injury depend on what is causing it. Because what I will list here is not something that everybody will have when they have acute kidney injury. It just depends on what is causing it, like I've explained some of the different causes. So the first thing you will notice that you have an acute kidney injury is a decrease in the urine output, the quantity of pee that you produce. Bear with me. If you don't drink water, you will not pee. So you should not be saying that, oh, I'm not peeing enough, so for that reason I have acute kidney injury. No. So you will take it relative to what you drink. As I'm saying, 2 to 3 liters of water a day. If you take 2 to 3 liters of water a day, you're expected to pee approximately that amount. If you take 3 liters, at least you should pee 2 liters. But when you are peeing less, when you're peeing less than even 1 liter, it becomes a concern. Because where is that fluid going? It's gonna end up to the second sign, which is swelling of your legs, your ankles, your eyes. Because your sorry. Okay. So when your kidney cannot send away, sense that there's excess water and send it out, it accumulates and it goes to your legs, your ankles, and your eyes, and you get those swellings. Once the urine output is less, then second, you start noticing that your legs are swelling, your ankles are swelling, you're becoming puffy. That's another sign that you should notice that, oh, there might be something wrong with my kidney. It's not sending out all these excess things. Suddenly you become so tired. At times you just sit the whole day, you're not doing anything, but you feel so tired. As I said, some of these symptoms are not all. It might be related to something else, but when you go step by step like this, again, you start feeling short of breath. We have had COVID and some of us have experienced short of breath where it's because of the cough, because of the infection in your lungs, and you are breathing in air, but you feel like you're suffocating. That's how you feel when you have acute kidney injury. Why? Because that extra fluid that your kidney was supposed to send out accumulates in your legs, they are swelling, suddenly they are accumulating in your lungs. When that fluid accumulates in your lungs, even when you're breathing, you still feel short of breath because it's like your lungs are drowning in water when they are not supposed to have that. And then when some of the chemicals that the kidney is supposed to eliminate, like potassium, is high because the kidney is not functioning well, you start feeling nauseous. You just suddenly begin to feel nauseous from nowhere. It's just because potassium, sodium, and other things are high in your blood. And then when it gets even critical, when you're seeing all these symptoms and you're neglecting, you don't go to the hospital to check up, then they slowly accumulate, and you reach a certain level where you become confused. You're confused because urea, which is that byproduct that the kidney is supposed to be sending out frequently, has reached a certain level that it is coming in your brain slowly. And once it reaches a certain level, you get into confusion. You suddenly start having headache, and you can even go into seizures and coma. But that now is an extreme case. But it's good to, as I'm explaining here, bear in mind some of these symptoms. If you start noticing it, please go to your GP. Go and consult. Explain these signs and symptoms. Some of the GPs might not pick it quickly. You can request, can you please check my kidney function? Then they will send you for a blood test to check your filtration rate and your creatinine level. Then they will know if there's an issue or not. It might be some of these symptoms can be as a result of some other disease, but it is good when you see them, check your kidney functions, because it might really be as a result of your kidney starting to fail. And the earlier we notice that, the better. One of the things that the kidney eliminates is potassium. I pick potassium because the level of high potassium level in your blood is vital. It is critical. It can cause heart attack easily. It can cause death. It can cause you to go into coma. And the kidney is number one that eliminates potassium, the extra potassium in your system. Potassium helps in the muscles of your heart to function. When you have excess, your muscles of your heart do not function regularly the way they are supposed to function. And when there's high potassium in your system, you start feeling very tired, and your muscles are weak. As I said, the potassium helps in the functioning of your muscles. So the muscles now get too weak when the potassium is high. You feel so tired. You start feeling numbness and tingling. You start feeling cramps on your legs, nausea, vomiting. You start feeling trouble breathing. Before you know, you are getting chest pain. If they check your heart rate, it is irregular. If they don't bring down the level of this potassium very fast, then you can get into cardiac arrest. That's why I bring up potassium to discuss this particular one, because it is very important. And most often, people that have high potassium levels, they at the level of the hospital, at home first, when you go and do your blood work and they say your potassium is slightly higher, it's an indication to tell you that start to take low potassium diets. Consume things that are low in potassium. Something like banana is very, very rich in potassium. That's the most common one that I will tell you here. I will go down. So if you go and they say your potassium is high, just start to eliminate some of those things. But if you get to a point that you eliminate and it is still high, at the level of the hospital, they are going to give you water pills, or they will give you other medications that will remove the potassium from your blood. And that water pill is to force the kidney to produce more P, because once it produces more P, in that P, there will be some of that potassium that will be eliminated. At times, you reduce potassium in your diet. They give you those medications for the urine to produce P, for those that can still produce P anyway, and all of that doesn't work. The only solution next is to do hemodialysis. Mind you, it doesn't mean that you just start hemodialysis and that's your new life. No, they do hemodialysis to clean your blood and take out that excess potassium quickly before it causes heart attack. And then if everything goes back to normal, you're not doing dialysis anymore. So it doesn't mean that once they do that dialysis, they might do only 1 or 2 rounds of dialysis and your potassium is back to normal and you don't need dialysis. They will take off that dialysis line from you. So as I said before, sources of potassium: orange. Those that have kidney problems should not be eating orange, should not drink orange juice, should not be eating banana, because these are things that increase the level of potassium in your blood, and your kidney already have problems, so it will not be able to eliminate the excess, and then you might lead yourself to hyperkalemia, which can lead you to heart attack, as I just explained. If you can look at my slide here, you will see some of the things that you will avoid. Those that have kidney problems, their doctors, or they always consult a dietitian who explain to them what you should and should not eat. I have a couple of them here. For time reason, I'll just move forward. So in what case, in what scenario would they suddenly need dialysis? As I explained, when that potassium level is very high, they can do 1 or 2 rounds of dialysis and that's it. You can also need dialysis if there's too much acid in your blood, because again, as I said, the kidney takes away some of those elements from your body. And when those elements accumulate, they can cause your body to be too acidic. Other parts of the body that are supposed to be alkaline or neutral, they become so acidic, then the body cannot function well. And it is only dialysis that will regulate this. Again, remember, when the kidney does not send away the excess water that you drink, it accumulates on your legs, they are swollen, it goes to your lungs. In your lungs, breathing is something that should not be compromised. When you're short of breath and they give you all that water pill and do all those other things to help eliminate the fluid in the lung and it's not working, it is only dialysis that will help to get that extra fluid out. And most people, once they do 1 or 2 rounds, they breathe well, everything goes back to normal and they don't need dialysis anymore. Excess of that urea in your system, it goes on your skin. And when it reaches a certain level, you start having body itchy. You see some of those people, some people that are even on dialysis, when they miss dialysis 1 or 2 days, before they go, they cannot even sleep at night. They are itching their whole body because the urea, that byproduct that the kidney is supposed to take out, accumulate on your skin, and it's very, very itchy. They get muscle cramps. They get they taste. They just lost appetite because they get bad mouth taste. Anything that they eat, it just tastes different. In such cases, when it's an acute kidney injury, they will quickly do 1 or 2 rounds of dialysis. That is fixed, and then your kidney goes back to normal and all those symptoms are gone. So as I said, acute kidney injury, most often people recover from it, your kidney goes back, but there are some criteria that will help. If you already had your kidneys that are functioning well, you don't have any issue, maybe you had just 1 kidney from birth. When you have an acute kidney injury, your recovery will not go back to 100%. Your recovery might go back to 90 to 80 because you had just 1 kidney. Also, recovery from acute kidney injury will also depend on your age. It will also depend on other illnesses that you had. Maybe you had heart problem, you had diabetes, you have high blood pressure, these diseases you had before you are having this acute kidney injury. So your recovery from the acute kidney injury will be less compared to somebody who never had any of these diseases. And somebody who is also younger, the kidney is still young, it will recover faster than somebody who is old. So that's acute kidney injury. Let's move to chronic kidney injury. Chronic kidney disease. This is an abnormality of the kidney structure or its function. Just like acute kidney injury, but this one lasts for more than 3 months. Then it is now chronic, it's not acute. Acute means sudden. It happens suddenly, we follow up what is the cause, we fix it, and that's it. But chronic, it has happened suddenly, we are trying to fix, it's not going, it's trying to get better, it's not getting better, until we find ourselves 3 months down the road. That now becomes chronic kidney disease. And it leads to other health complications. And you use, they have to do a biopsy to determine that you have a chronic kidney disease. They do an ultrasound, they do a CT scan, they do an MRI, because it's a dysfunction of the kidney or the structure of the kidney, something's wrong with it. When they do any of these tests, usually they will start with the biopsy where they will get a piece, they go through the procedure, get a piece of that kidney, go and test it, and see, figure out what is wrong. And then they will do an ultrasound to see the structure. Then they do CT scan, and MRI is the most detailed that they will see. And then when they do all of this, they can start now treatment to test the level of your kidney function. 2 main things, your creatinine level and your glomerular filtration rate, which is the rate at which your kidney filters that 20% of blood that flows through it every minute. And the level of creatinine varies with your age, with your sex, with your race, and if you have other diseases, because the normal range for creatinine in a male is different from a female. The normal range for creatinine for a white is different from a black. The normal range for creatinine for somebody who is diabetic and high blood is different from somebody who has no diabetes, no high blood. So they have different ranges, and it is important to know that range, because once you know the range, you will know once some people, like in Ottawa, people are connected to my chart where when you do blood work, you can have your results. You can have an idea from your blood work or from urine tests once you go to my chart to see, oh, I don't have this, I don't have diabetes, I don't have this. My normal, me as a female, my normal creatinine level is supposed to be 0.5 to 1.1. But I am seeing this, so this is a concern. Even before the doctor is calling you, you have seen it. If at times the doctors might not pick it up, you can say, oh, my creatinine this, or it is just slightly 1.2, 1.3, that you start saying, oh, I need to start drinking water. I need to start avoiding this to get it back to that normal level. And then they can also stage the functioning of your kidney using this glomerular filtration rate and how damaged your kidney is. People that have no problem with their kidney is not damaged. You look at it through the ultrasound or CT scan, everything is as normal as it's supposed to be. There's no damage. And then the filtration, that 20% of fluid that goes to the kidney is filtered normally as it's supposed to be. Then they will say your kidney function is more than 90%. That one, you are good. Usually it is like that for young people, people with 2 kidneys and so on. Although it's not the case with everybody, some people are born with kidney issues. That's stage 1. Stage 2 is when your kidney is slightly damaged. They do the ultrasound, the biopsy, MRI, they see that your kidney structure is slightly damaged. And the filtration rate is also reduced a little bit as a result of that slight damage. Now the function of your kidney is 60 to 80%. Then you have moderate damage of the kidney, moderate decrease in the filtration rate, you go to 35%. And then we end up with chronic kidney injury where there's severe damage and there's severe decrease in the filtration rate. That's where we find ourselves with 15 to 29% of kidney function, and most people at this level, they are on dialysis. Then we have the end-stage renal disease, where some people, their kidney do not function at all, and most of such people do not produce urine. They rely on dialysis totally for a prolongation of their lives. Causes of chronic kidney disease, just like we saw the causes for acute kidney injury. If you look at this, I'm not going to elaborate too much for the sake of time. You will notice two things. Diabetes, 40%, high blood pressure, 27%. I understand most of us here are Blacks. And if you have not heard it, we are prone to high blood pressure. By nature, we are prone to high blood pressure. So even if you don't have high blood pressure, your race puts you at risk for it. So you should always be on the guard for it. And knowing that high blood pressure and diabetes are the two big things that can cause chronic kidney disease, it is very, very important that those that already have diabetes and high blood pressure should watch out. Watch out to keep them under control. If you control your diabetes level very well, it will not affect your kidney. If you control your blood pressure very well, it will not affect your kidney. Because when your blood pressure is too low, remember, less blood goes to the kidney is affected. When it is also too high, it affects the kidney, affects its structures, and it doesn't do its work well. So, sisters, brothers, fellow listeners, if you have anybody who has diabetes, has high blood, tell them to put an eye on their kidneys. Tell them to watch out for things that will increase their potassium level. Make sure that their sugar level, if it's uncontrolled, go to the hospital. Maybe you need more insulin to help to bring it down. Maybe you need to talk to a dietitian to control your diet. Those with high blood pressure, there are so many things that some people don't want to take pills, they exercise. But if you take all the other methods and they are not working, please go and start taking your medications, because you're also putting your kidney at risk. Likewise, those that have kidney issues eventually have high blood pressure because of the kidney. So they work hand in hand. Complications that come with chronic kidney disease. As I explained, the functions of the kidney, that the kidney produces hormones. Most people that have chronic kidney disease are anemic. Why? Because the kidney can no more produce this hormone erythropoietin that helps to produce red blood cells. So most often when they go for hemodialysis, they transfuse them. They give them blood. Why? They cannot produce their own blood anymore because the kidney cannot produce this hormone. That's a complication that is coming as a result of your kidney. That's why it's very important to take care of the kidney before it leads us to this level. Some people, another complication for the chronic kidney disease is renal osteoporosis. This is a decrease in the ability of the kidney to convert vitamin D to D3, because it is D3 that can be absorbed by the body. And again, this hormone that helps is calcitrol, produced from the kidney. When the kidney is bad, it cannot produce it. It means you cannot consume vitamin D directly. Most kidney patients, they put them on vitamin D3 directly. You cannot just get vitamin D. Again, calcium, you cannot consume calcium. Even when you take it, your body cannot use it because there's no calcitrol. So convert it to the state that the body can absorb. Chronic kidney injury will lead to cardiac issues. Cardiac issues, yes, because remember I told you that kidney eliminates high potassium. Cardiac issues will come as a result as the potassium is high. Then it is that potassium that regulates the muscles of the heart and other body muscles, mostly the heart. And when that potassium is high, the way it helps now with the muscles of the heart, it makes it irregular. The heart doesn't pump, it doesn't contract, relax the way it's supposed to be. And that can lead to many cardiac issues. Even calcium. When the kidney does not produce calcitrol, for calcium to be absorbed. The calcium stays in the blood. When it remains in the blood, it accumulates in the blood vessels. When it accumulates in that blood vessels, it blocks the blood vessels, and it can lead to a disease called tachyphylaxis. It is very, very painful. Most dialysis patients, they have it, or people that start dialysis late. This calcium has accumulated in their blood vessels and has led to tachyphylaxis, which is a whole different treatment from dialysis. So you see that once the kidney has really failed and you are having chronic kidney disease, these are some of the complications that come with it. What's the difference between a chronic kidney disease and an acute kidney disease? The main difference is just that an acute kidney disease, it starts suddenly and it can be treated very fast. Just noticing what has caused it, we can easily reverse it, and most people go back to their baseline of kidney function. But chronic kidney disease, it slowly progresses. It starts and then slowly you're trying to treat it. It's not getting better. It's just getting worse. And most often, if you don't take treatment, which is dialysis or other treatments, 100% of people who do not take treatment with chronic kidney disease, they die. But people with acute kidney disease, most of them, they recover. I'll just keep some of the slides. So signs and symptoms of urea. Urea is a byproduct of protein breakdown. We exercise, we eat protein. When it's broken down, we get urea. Like I said, when this urea accumulates in your body and the kidney does not send it out, you start having symptoms: fatigue, weakness, malaise, restless leg, muscle ache. And then once it gets to your brain, you start having confusions, coma, seizures. How does it affect your heart? It causes high blood pressure. It causes you swelling. Your whole body swells. You just gain weight because of that excess fluid that is in you. Excess urea will cause short of breath, pulmonary embolism, that's fluid inside your lungs. It will cause nausea, vomiting. It will cause you to produce less urine or no urine at all. And then, to a certain extent, it is on your skin and your body is itchy. Your skin is so fragile, you spend your whole time itchy. When is it time to start dialysis? After you have had acute kidney injury. I've explained that with acute kidney injury, they can do a couple of rounds of dialysis and you go back. Chronic kidney injury, it gets to that point, it is chronic, you need to start dialysis. And now your doctor start telling you, you are now chronic kidney injury. What? Your next bet is dialysis. Are you ready for dialysis? And what type of dialysis? At what point does the doctor start talking to you about it? It is good to start talking about it, giving you the options early, but some doctors will leave it until when they start seeing these symptoms, this nausea, vomiting, confusion, cannot breathe, they struggle to give medication and all of that is not working. Then they start saying, you see, we have tried this, it's not working. I think it's time to start dialysis. And then they do blood work and the levels are showing that they are too high. You need to start dialysis. And what are the treatment options for dialysis for a chronic kidney injury? Because once it gets chronic, then it goes now to the end stage. We have treatment options. Number one is renal transplants. I don't know, maybe some of you here are donors. You have signed that you can donate the kidney. It saves lives. We have seen so many maybe family members that have had kidney transplant. It has prolonged their lives. It is helpful. It is very, very helpful if you can sign up to donate a kidney. I know people have their own reasons why and why not, but trust me, it helps. My unit where I work, we specialize in taking care of people that have all these kidney issues, and most often we care for people that come. We prepare them to go for a transplant. After the transplant, they come to us, we get them ready, advise them, counsel them, and then they go home. Even with complications with the transplant, they come back to our unit and we take care of them. So if you can, transplant is one of the best options. Hemodialysis is another option. Hemodialysis, you can do it in the hospital where you have to go 3 times a week and you are connected to the machine 3 to 4 hours every time you go for a section. And then you also have another type of dialysis that most people do not know, peritoneal dialysis. For hemodialysis, this is you connected to the machine, and the machine, I have this slide here where you can see the differences. Hemodialysis, you need to have a blood access, and then they connect you to a machine, and that machine pulls out your blood, cleans it, like do what your kidney is supposed to do, and bring it back through another tube into you, and do so it does that like a cycle over and over for the 3 or 4 hours that you're connected to that machine. And then you go home, and then you come for the 3 days, and that's how your kidney functions. Some people at this point, the kidney does not function at all. Some is just 10-15%. So they rely on this machine to clean, to take out the excess potassium, excess fluid, all those excess things, because if they don't do it, they cannot live. If you stop dialysis for 1-2 weeks, there's nothing hoping for. We'll pray God take control. And there's also peritoneal dialysis. This one, it has nothing to do with blood. There's a tube that is inserted in your peritoneal, it's in the membrane in your stomach. And then it stays there for a while, gets attached to it, and then they test it to see that it's not leaking. And then you start now the peritoneal dialysis. It is solutions with different concentrations that are installed in you. This one you can do at home. You have machines. You can have nurses that will come and help set it up. They can teach you to do it, you or your family member to do it personally. They just give you the supplies. And for those that cannot do it of age or whatever, the nurses can come and set it up in the night. In the morning, they disconnect. But they connect you to a whole bunch of solutions, different concentrations. And those solutions drain into you, stay there for some time, filter, take out the waste that your kidney is supposed to do. Then that what the fluid that was sent into you drains out, another one fills in, and you can do that for 8, 9, 10 hours all night. In the morning, you're disconnected, you go and you do your activities. In the night, you do this. When you're doing peritoneal dialysis, it's a daily thing. Hemodialysis, you do it 3 times a week. Sometimes they can increase the number of times you do hemodialysis depending on the need. If they notice that there's too much fluid, and at times with hemodialysis, remember, blood is life. The machine pulls this blood out of you and then filters it and sends back. When it pulls it out, your heart senses that there's less blood. It's pumping fast. Your brain, it affects you. And some people cannot tolerate the low blood pressure. They go into coma. They go into crisis while in dialysis. Some people, while in dialysis, because it is the machine that is removing extra potassium, it might remove too much. It might remove too much water, because the kidney is naturally made to sense the right amount. But now it is the machine, and we set that machine on how it should work, on what it should remove, how much water it should remove. We might set it too low or too high. And when you remove too much, then you start feeling the side effects. Some people during dialysis, they have too much cramps. They cannot tolerate. A 4-hour session, some people do just 2 because they become too sick and they cannot do that. And when they do only 2, it means that most of these toxins still remain in your system. That's why we say kidney transplant is the best of these treatments. Peritoneal dialysis, likewise, where you have just this fluid, they don't pull your blood. It has its own effects, because with time, that membrane that does that filtration do not do it again well. You put in the water, at times it's difficult for the water to go in. At times it goes in, it is difficult for it to come out. At times that tube that they put in gets infection, because you have to be sterile the way you connect and so on. Because it's open a little bit at the entrance, some people do not take care of it very well. They get infection, and with that infection, that membrane that filters get affected, it cannot filter anymore. You can then switch to hemodialysis. But some people cannot also do hemodialysis, because when they're doing hemodialysis, their blood pressure get too low, they get cardiac arrest, they can even die. Some people die while doing hemodialysis. I'm not scaring you, but I'm just explaining some of the pros and the cons with the different dialysis options that you might have. A picture here is just showing you how you can be connected to a hemodialysis machine and they do the dialysis. So trying to round up, I'm going to skip some of the slide. I'll move to tips of a healthy kidney. How do we have seen these diseases. We know how our kidney, the uses, the functions of the kidney. We have seen how the kidney, the things that the kidney does, and we know it is very vital that if these things are not being done, we will develop all these diseases: acute kidney injury, chronic kidney disease, end-stage renal disease. How can we avoid them? How can we take care of the kidney so that it continues to do these good things, avoiding us to be anemic? Avoid taking over-the-counter drugs frequently. We all take it. I take it. Frequently is the key. So many pain medications, Advil, naproxen, I told you, they are helpful when you are in pain, but you take it frequently, you take the wrong dose, you take it wrongly, it will affect your kidney. Antibiotics must be prescribed, because when the doctor is prescribing it, they take into consideration so many things. When you just take it, and even when, I always say this one is out of kidney, but when you take antibiotics, make sure you take your full dose, because if you don't take it, you become resistant to it. And there are some antibiotics that some people already have kidney issues. You have limited antibiotics that can treat infection. And then you don't take your full dose, you become resistant to that antibiotics. You have less options of antibiotics now for the doctor to give you for an infection. Why? Because some of those other antibiotics, if they're prescribed, is going to damage your kidney even more. So watch out over-the-counter antibiotics and make sure those that are prescribed to you, take them accordingly and take your full dose. Eating healthy. Eating healthy is very, very important. Those of us that still have our kidneys functioning very well, eat healthy to keep that kidney functioning until death do us part. Eat your veggies. Take your fruits. Drink as much, 2 to 3 liters a day, to flush, to help your kidney eliminate what it's supposed to eliminate and do its job easily. Watch out for salt. Salt contains sodium and other products. The kidney, when you eat so much salt, you're giving that kidney so much work to be eliminating it. And salt will affect your blood pressure. Remember, I said blood pressure and kidney function, they work hand in hand. So if we can reduce salt, it's going to help us with our blood pressure. Us, the Black people that are already prone to high blood pressure, reducing your salt will help with that. Reducing your salt will help with your kidney function. Drink enough water. I can't emphasize. Drink, drink, drink. It helps to flush. It helps to flush even the excess calcium that is in your vessels. Once the blood is not thick, it's fluid, it flows easily. It helps your kidney function. Exercise. As we exercise, our hearts pump. The excess of everything within us, the organs, they work well when we exercise. Use it or lose it. If you don't use those muscles, you don't use your heart, you don't help it to pump the way it's supposed to pump. If pumps sluggishly, that's how it sends less blood to the kidney, and that's how the kidney gets less and it's affected. After you do all of this and explain the signs and symptoms, once you start noticing those signs and symptoms, get screened. Get screened. Once you get screened and the doctors are talking about creatinine, you know that creatinine is a byproduct that the kidney is supposed to eliminate. If my creatinine is high, it means my kidneys are being affected. I should watch out. I should start drinking. I should start taking care of that kidney. That's a sign. If you don't screen, it might get to acute kidney injury, can get to chronic kidney injury without you noticing. Go to your GP. Once you notice those signs, these are the signs I'm having. Can I have a kidney check? It can just be a urine test. It can be a blood work. They will tell you if your kidney is doing okay or there's a little bit of something. Be careful with alcohol. Usually when you're taking antibiotics, they say don't drink alcohol, because a combination of both of these is not good for your kidney. Likewise, smoking, the nicotine and all those byproducts. Remember, there are ways, there are things that go into the body that the body does not need, the kidney has to send it out. When you're taking excess of all of this, you give more work to that kidney, and the more and more you do it, then at one point the kidney cannot handle it anymore. It slows down, and slowly, it's losing its function. Manage any health challenge that you have. Diabetes, high blood, name it, cancer. Excuse me. As I said, you can have prostate cancer, you can have urinary tract infection, and it will affect your kidney. So if we follow these 10 things, it's just a summary of what I've put here. It's going to help with our kidney. What are some of the things that we can eat to boost our kidney function? Blueberry, cranberry. It doesn't mean that you will not eat all these other ones, but these ones are good. They have things, they contain chemicals that help to flush our kidney, help to boost the functioning of our kidney. Fish, olive oil rather than our normal vegetable oil that we use in cooking. Cranberry is very good. Cranberry fruit, the cranberry juice, it helps people that have frequent UTI. It helps to flush your urinary tract system. And once that is clear, it prevents some of the causes of a UTI. Sisters, I know I've gone above my time, but I will conclude by saying, take care of your kidney, and the kidney will take care of you. At this point, I believe some people have questions. If we can take a few minutes to answer, for me to answer those questions, I am available. Thank you.
Oh, thank you so much. Oh my goodness. Oh my God. What a thing. Thank you. God bless you, Mom. My question. So some people are born with only one kidney?
Yes.
Really?
Yes.
I didn't know that, to be honest.
Yes.
Oh, okay. And some people are born with a kidney disease?
Yes. We have some kids that from birth, they are diagnosed with, like, if you go to Achu, you will have the kidney, just like a kidney unit, just like we have
cancer unit and all of that.
Yes. So yes. So some kids are born with kidney issues because maybe it can be as a result of pregnancy issues.
Oh.
It can be as a relate, or it can just be how do I say
like somebody that drinks during pregnancy?
Not necessarily. I don't really know how that can be linked.
Okay.
The word is not coming.
It's okay. Okay. Let me go to the next question.
Yes, but it does happen. We have kids that are born with kidney issues.
Can it be hereditary?
Kidney issues. Some cases, yes, they say if you have close family members that have kidney issues, then you have to start watching on your kidney because there's a possibility. Remember, there are some of these causes of kidney injury, kidney diseases that you, like high blood pressure is hereditary, diabetes is hereditary. Once in your family, you already have all of this, and I have explained to you the direct link of this with kidney, then you already see now the trend that if diabetes and high blood is hereditary, then kidney, you can also inherit it.
Okay. Renal transplant. You said that was the best. So if I get a renal transplant, say somebody has it and then they get a renal transplant, you can live normal without dialysis when you have a renal transplant?
Yes. For renal transplant, we have two. The living, somebody who is living can give you one of their kidney because you can function well with, usually they will do a test and see if both kidneys, like I had given the stages, right? You are above 90%. Some people, they are good to give because they can live the rest of their life with one. And somebody can decide to donate. They will do a match. Some people, it's a relative that will give you. Some people, your relative, your kidney doesn't match. So they will match it with somebody else and then take their own and match with just a cross match that they can do. Another transplant that they can also do is disease. Some people die if you have signed that they can donate, you can donate your parts, your body organs. Kidney is one of those that is harvested. We have doctors that are specialized in harvesting it. Some people are on life support and they have already signed. So once they are pulling the plug, as they always say, they pull the plug. Those doctors that are specialized in harvesting the kidneys, they are there. Once they pull the plug, they harvest it, they know how to preserve it, and then they announce that there's a kidney available. They already know every detail about who is diseased, and they know now people that are on the waiting list, waiting for kidney, they match it depending on their blood work, their blood type, all of that. And then somebody can also suddenly have an accident. Somebody must not be on, like, they pull the plug. People have accidents and suddenly the kidney is available. They have two. On our unit, they will call two people. It's somebody that suddenly has an accident and they have harvested the two kidneys and they need two people to transplant the kidneys. And they come and they do that. So as you go back to your question to elaborate more, people have the transplant, and living kidneys will function better than
the one that died.
Yes. Not that the kidney died, but the problem is that somebody who died and they harvest the kidney, there's a whole different process, and so the kidney is affected in a way, and it's a little bit more complicated.
Yeah.
And some of those diseased kidneys already have some diseases that the doctors are transplanting. Why? Because they have looked into it and they have seen that it will be beneficial. It can work. It can help this person for 2 years rather than them being on dialysis.
Oh, okay.
So they will do it. But if you have a living kidney, it is very good. It can last you 5 years. It can last you. I've seen patients that have had kidneys for 15 years transplanted. But again, in the long run, if you don't take care of that kidney, follow all these processes even after transplant, just like somebody who did not have the transplant is taking care of their kidney, if you don't take care of it, it is how much you take care of it, then it will last long. Because some people have it, once you have that transplant, you are on immunosuppressant medication for the rest of your life.
Oh.
And when you don't follow in taking those medications, your body will reject that kidney because you are taking that medication to suppress your body from recognizing that kidney as a foreign body.
Wow. Oh.
If you don't take them, then your body begins to sense that kidney as a foreign body. It rejects it, it stops working. But if you take care of the kidney, eat properly, take those medications, the kidney will last long.
Oh. Oh. Okay, but at least the transplant is better than dialysis, because I was going to ask the next question about hemodialysis, but that actually helps because I think the hemodialysis is painful.
Yes, it has its own side effects, and it got to a point you can only do it for a period of time. At a certain point, your body can't take it anymore.
Oh.
Then if you don't have that transplant, you're slowly dying.
Okay. Wow. Wow. Thank you so much. Another thing you talked about that I picked on it was salt. I used to remember when young girls used to date men, and you would date somebody and you go and have sex and you're afraid that you don't want to get pregnant, or even married women, you don't want to get pregnant, and then you drink salt.
Yeah, we have to really watch out with our salt in everything that we eat, because
all right, let me see. Some people have questions in the chat here. I don't know. Please, if I missed your question, please, you can unmute yourself because I might not be able to get to it. If somebody asks, is the presentation deck available? Oh, you have the link for the YouTube. It's recorded on YouTube, so you have the YouTube link for sure. Please, can we have the slides sent to the group? Okay, somebody's asking for the slides. Yeah, very powerful. Okay, how does UTI affect your kidney? So maybe take this last one from Stella, and then we will disconnect from YouTube and then close.
I explained that UTI. Remember, one of the causes of acute kidney injury, I said that it can be as a result of something not connected to your kidney. Your kidney is functioning very well, but it's something that your body, like diabetes, is not controlled very well. High blood is an issue, and it can affect your kidney. UTI is your kidney functions very well, produces the urine, it goes to the bladder. UTI is urinary tract infection.
I was going to ask what is UTI. Thank you for saying that. Good.
Urinary tract infection. So
Okay.
the tract through which the urine is
Mhm.
produced and let out has an infection. Once it has that infection, it affects your kidney in the sense that that flow out of that product of everything that the kidney has produced as urine and it is in the bladder.
Mhm.
Maybe that urinary tract infection can be an infection in your bladder. It can be an infection of the urethra that leaks the urine out.
Mhm.
And there's that backflow. There's that accumulation of that urine at that point of all those byproducts, those chemicals that are there. It goes backward to affect your kidney function. Because remember, the kidney has produced all of this and you have to send it out, but it's not going out because you have that infection in this tract.
Mhm.
So in the long run now, it affects the kidney.
Okay.
That's why I will recommend, it's something I do, I will recommend cranberry. Once in a while, drink your cranberry juice. It helps to flush. It helps to prevent frequent urinary tract infections. It's very common with the aging people. I see a lot of them in the hospital, and once we admit them, we give them cranberry juice. It helps. In as much as they are on antibiotics, but they are encouraged. Even most retirement homes, they give it they supply the juice that they mostly give to those old people is cranberry.
Oh, okay. I didn't like cranberry juice, but I'll start loving them now. Vero says that what level of potassium must you have in your blood? Well,
that I will not give numbers that I'm not quite sure about.
Yeah.
But
I would say that we wouldn't be concerned
potassium
about that unless you have a kidney problem.
Should be 3 to a maximum of 4. If you start having a potassium of 5 and above, that's too high. I'm not 100% sure with my numbers, but a potassium of 4.5, 5, 6, 7, heart attack.
Wow. Wow. Okay, thank you. Okay. Golda says that between hemodialysis and peritoneal dialysis, which one is more important? I would think hemo. Go ahead, Ade. That's the last.
Yes, I had a slide. It's just that I was pushing through the differences with the hemodialysis and the peritoneal dialysis. It goes with you as an individual because there's an advantage and a disadvantage with both. And some people cannot do hemodialysis. Some people cannot do peritoneal dialysis. Reasons being, peritoneal dialysis, you have to put the tube in the peritoneum, and it is the peritoneum that does that filtration. Some people have had so many surgeries, they have scars in their stomach, that it becomes difficult to put that tube. And those scars have gone through that peritoneum so that you don't have a flat layer, a thin layer, which is supposed to be for that filtration to take place. So once you have all of these, then peritoneal dialysis, even if you want it, it cannot happen. And then some people cannot handle overnight connection to the machine. Although you can also have peritoneal dialysis where you just do the exchanges 4 times a day. That's also so much work. You need time when it comes to that, such that you can just take a 2-liter bag of that solution, fill your tummy with it, stay for an hour, drain it. You can do it 3 times a day with your meals, breakfast, lunch, supper. Or you just do the one time where you connect yourself to that machine. It does it for the rest of the night. In the morning, you disconnect. But again, as I said, some people might like it and they will not be able to do it because of that. And some people, they have the tube put in. It doesn't function well because they frequently have infections. And with that infection, the fluid cannot get in fluently. At times it gets in, it cannot get out because of the infections. Then you are forced to do hemodialysis. Hemodialysis has its own advantage in the sense that you don't have all these complications. They don't need to put that tube, but you need a hemodialysis line. They go into your central, one of the central veins that lead to your heart. They put a line, or they put a fistula on your arm, through which the blood will be flowing in and out from you to that machine and back. Some people do not have good veins that they can put in. Some people go through with the fistula. Fistula, they open one of the veins in your hand and make it big, such that those big tubes from that the big pipes that they can connect and take to that machine will go through. Some people cannot do hemodialysis because they cannot tolerate that pull out of blood and back. So some people, once they are connected to that machine, they start having cramps. Some people just go into a coma because of low blood pressure. So in as much as you like it, it might not work for you. So it is what works for you. Some people have been doing the hemodialysis for years and they are fine with it. Some people do peritoneal dialysis for years, they are fine with it. It is what works with you.